Hello, and welcome to the video series, Understanding Culturally and Linguistically Appropriate Services. This video will provide an overview of the theme, Communications and Language Assistance. During this session, the participant will examine why the national class standards are important, identify the Communication and Language Assistance standards, and explore different approaches to implement the communication and language assistance standards within their organization. Our goal is after the video, you will have a high-level understanding of the whats, the whys, and the hows of the communication and language assistance standards. So what are the national class standards? To provide a little bit of background, the national class standards were first implemented in 2000 by the Health and Human Services Office of Minority Health to help address and reduce racial and ethnic health and medical care disparities. Now, after feedback from public forums in 2013, the standards were revised to what we have today to increase user-friendliness and broaden guidelines. The national class standards were developed to ensure the availability of culturally and linguistically appropriate healthcare and medical services for anyone and everyone who needs care. CLAS provides organizations with 15 action steps intended to advance health equity, improve quality, and help eliminate healthcare disparities by establishing a blueprint for health and healthcare organizations. Now, there is no single correct way to implement the national class standards. An organization may decide to implement some, but not all of them, or they may wish to implement some sooner rather than others. As mentioned, today we'll be reviewing communication and language assistance. This includes standards 5 through 8. Communication and language assistance theme broadens the understanding and application of appropriate services to include all communication needs and services, including sign language, braille, oral interpretation, and written translation. These action items provide guidance on how to effectively meet patient communication needs. In addition, the action items in this theme will help organizations comply with federal requirements, such as Title VI of the Civil Rights Act of 1964, the American with Disabilities Act of 1990, and other relevant federal, state, and local requirements to which your organization may need to adhere to. Standard number 5 has to do with offering communication and language assistance, which helps an organization make sure that individuals with limited English proficiency and/or other communication needs have equitable access to health services. It also assists organizations to improve patient safety and reduce medical errors related to communications. On this slide, you'll see examples of implementation activities, such as analyze the language needs and average literacy levels of patients in your service area through observations, clues, self-assessments, focus groups, and interviews with existing and new patients. Determine and provide appropriate language assistance for your clients and organization. And ensure staff is aware of and trained in the use of language assistance services, policies, and procedures. Standard 6 has to do with informing individuals of the availability of language assistance services, which will help organizations inform individuals with limited English proficiency in their preferred language that language services are available to them at no cost. Examples of implementation activities would be to post signs regarding availability of free language interpretation at all points of entry in the language and literacy the client will understand. Develop a process to determine a new client's preferred language during intake process and add to their record. and also create a written policy that offers interpretation at no cost to the client to prevent the use of family and friends as interpreters. Standard 7 has to do with ensuring the competence of individuals providing language assistance, which will help organizations provide accurate and effective communication between individuals and providers, as well as empowering individuals to be able to make informed decisions about their health. Examples of implementation activities for this standard would include using medical interpreters that are trained, tested, and certified. Assess interpreters via an independent certified system to ensure they are proficient as language interpreters. Use a competency checklist for bilingual staff who provide interpreting services and do ongoing assessment, and also partner with local organizations and universities to offer medical interpretation courses to staff. Standard 8 has to do with providing easy to understand materials and signage. It will help organizations make sure that the reader of other languages and individuals of various health literacy levels are able to understand and access care. Examples of implementation activities for this standard include creating forms in languages that represent the community served. Test health educational resource materials with patient populations and focus groups or with community health workers for cultural and linguistic appropriateness, and to ensure that materials are written at a 4th to 6th grade reading level. It is also important to focus on the correlation of the CLAS standards and health literacy. Implementing CLAS standards is one strategy to improve health outcomes by accounting for the culture and language of the people and organizations serves. However, it's particularly effective when it's used with other efforts, like accounting for variability and health literacy. Broadly speaking, health literacy is the degree to which individuals have the capacity to obtain, process, and understand basic health information and services needed to make appropriate health decisions. But how do CLAS standards and health literacy work together? This diagram gives a few examples of how individual characteristics like age, education level, culture, and language, as well as many others, can impact our ability to understand and apply health-related information. In turn, this affects our health outcomes, including the kinds of protective behaviors we engage in and our use of healthcare services. If we can communicate with patients in ways that account for their individual characteristics and their health literacy levels, we can help these patients navigate and use the health system in ways that work for them. Essentially, organizations that adopt the national CLAS standards and provide materials for people with lower levels of health literacy help more people access services and care that they need. There are two important parts of health literacy: individual health literacy, which is the degree to which individuals have the ability to find, understand, and use information and services to make informed health-related decisions and actions for themselves and others. This is what we covered on the previous slide. There are many factors that impact whether someone has higher health literacy, lower health literacy, or if they're somewhere in between. This is what most people think of when discussing health literacy, and it's helpful to think of it as a state rather than a trait. Everyone can learn about and improve their skills related to finding and understanding health-related information. As we saw on the last slide, there's a lot of evidence that health literacy is related to health behaviors, health status, and health outcomes. People with higher health literacy tend to smoke less, exercise more, report better general health, visit the ER less frequently, and perform better chronic disease self-management. The other piece of health literacy is organizational health literacy. This is the degree to which organizations equitably enable individuals to find, understand, and use information and services to make informed health-related decisions and actions for themselves and others. This can include using strategies like the teach-back method when interacting with patients, as well as using plain language and patient communications. It's a good idea to structure the delivery of care as if everyone may have limited health literacy. You cannot tell by looking at someone whether they have a higher or lower health literacy. Health literacy skills don't always mean full understanding. Anxiety can reduce someone's ability to manage health information. Everyone benefits from clear communications. So to recap the communications and language assistance theme, this includes standards 5 through 8. It's important to ensure that individuals with limited English proficiency and/or other communication needs, such as sign language or Braille, have equitable access to health services. It's important to ensure language services are available at no cost to the patient. It's important to enable all individuals to make informed decisions regarding their health care and service options. It's also important to ensure that readers of other languages and individuals with various health literacy levels can access care and services. In closing, health equity is the attainment of the highest level of health for all people. Culturally and linguistically appropriate services are increasingly being included in or referenced by local and national legislative, regulatory, and accreditation mandates. Both the Joint Commission and the National Committee for Quality Assurance have established accreditation standards that target the improvement of communication, cultural competency, person-centered care, and the provision of language assistance services, even without a regulatory mandate. Looking holistically at improving health literacy can help healthcare organizations gain a competitive edge in the marketplace, decrease liability risks, and provide equitable, safe, quality healthcare and services. The pursuit of health equity must remain at the forefront of our efforts. CLAS is a way to improve the quality of services provided to all individuals, which will ultimately help reduce health disparities and achieve health equity. Included on this slide, we've included tools for you to review to promote health literacy. So in conclusion, we thank you for reviewing this video, and if you have any additional questions, do not hesitate to reach out to the Superior Health Quality Alliance.